Hi, my friends. Today is Sunday, and yes, I'm working. I just wanted to share with you the following. I just finished seeing a patient that came for a routine health exam. Um, First time patient, no major medical complaints except weight loss, 6 pounds in the last 2 weeks, lack of appetite, low menstrual periods. The mother has history of thyroid problems. The father has history of high cholesterol chronically. So I do the blood. Obviously I did the exam. Um, as far as the lab work, I will order the routine lab work, cholesterol, CBC, urinalysis. But with a history of thyroid conditions, we are going to order thyroid profile with also ordering thyroid antibodies because 80% of the conditions get misdiagnosed um, with if we're not checking antibodies. The other thing that we will check is genetically. We want to see if she has a genetic defect that makes the family produce cholesterol. We are checking some other omegas, low iron. Low iron can cause lack of appetite. Another thing that I noticed when I examine the patient, and that's why an actual examination is so important, because I noticed that as soon as I got her on the table facing down, there was an asymmetry of the spine. And why is that important? Because we don't know if it is just misalignment, but in her case, it was more than that. She was positive for scoliosis, very marked scoliosis. And the mother said that a year ago she took her to the doctor because she was concerned about the hump on the right side. So the doctor just said it was scoliosis and did not order x-rays. And why is x-rays important in this case? We need to determine the degrees of scoliosis, because depending on that degree, we know if it is conservative therapy, or if she needs a brace, or if she needs a surgical intervention. And the only way to determine that is by an x-ray. So I gave her the order for that. I'll be seeing her in 10 days. But I cannot emphasize enough the importance in doing a routine health exam and being thorough, because family history matters a lot. It places a burden and future chronic conditions that can develop. And if we catch them on time, we can do lifestyle changes to help prevent that genetic burden. But most important, doing an annual exam allows us to be able to identify abnormalities that can be missed. She's a 19-year-old female going to college. The least thing in her mind is obviously her health, but she really cannot function if she has health conditions underlying her weight loss. She's fatigued, sleeps a lot, and obviously we're checking for underlying anemia, but primarily a thyroid disorder that might be present. But again, we cannot tell that by just listening to the heart, the abdomen, or the lungs. We need to do blood work to be able to get to the root of the cause. And as you know, functional medicine, uh, it is basically trying to get at the root of the causes and prevention, 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 prevention. So see you soon, my friends. Thank you so much for your time.